Good morning, good afternoon, and good evening, everyone, from wherever you may be joining us in the world today. My name is Francesco Del Carpio, and I am the CFAL York Operations Coordinator, and I would like to officially open the sixth session of our AI for Global Health Challenges and Lessons Learned speaker series with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have longstanding relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Tkaronto and has been caretaken by the Anishinaabeg Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation, and the territory which is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event, our participants may be joining from various locations, so I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderator, our speaker, and our participants from around the world. Welcome to our webinar. Without further ado, it is my great pleasure to introduce our moderator, Dr. Blessing Ogbuokidi. Dr. Blessing Ogbuokidi is a postdoctoral fellow and instructor at York University, Canada. He has over 15 years of combined professional experience across a broad range of fields in academia, industry, and community-based organizations. He is a dynamic team player who is eager to utilize his diverse talents to advance in research and innovation. Dr. Ogbuokidi is interested in machine learning for health, data science for social good, social media computing, natural language processing, and theoretical computing. His goal is to actively collaborate with researchers in several interdisciplinary groups in using AI to help government and local communities to contain and manage the spread of community-based infectious disease outbreaks such as COVID-19, malaria, and Mpox. Dr. Ogbuokidi, thank you very much for moderating today, and the floor is yours.
Thank you very much, Francesco, and welcome everyone for today's talk. And we are so glad to have you today, all of you joining from all over the world, wherever you have joined. I say again, welcome to the webinar. Today, I would like to introduce our speaker for today. But before I do that, I would first of all tell us some of the house rules that we're going to observe today. Number one is that we are going to be having question and answer section. And in the section, you can actually put your questions in the Q&A section, or you click on the raise hand bar to be able to speak if you want to speak. I will now go to introduce our speaker for today. Our speaker for today is Dr. Mpho Raborife. Dr. Mpho Raborife is an NRF-rated researcher specializing in computational linguistics. She is the Deputy Director of the Institute for Intelligent Systems, University of Johannesburg. Amongst numerous awards, she has received Laurel UNESCO Women in Science Sub-Saharan Regional Fellow, as well as the Deputy of Science and Technology South Africa, Women in Science Alumni, and most recently, the National Research Foundation South Africa, South African Research Excellence Award for Early Career Emerging Researcher. Professor Mpho Raborife has worked in numerous projects, multidisciplinary, with project partners across the continent. She currently serves as the IDEMIA Black Women Ownership Trust Board of Trustees, as well as on the advisory board for the Pan-African Information Communication Technology Association. And the floor is open for Professor Mpho Raborife for your talk. Thank you.
Thank you, Dr. Blessing. Good evening, everyone, and those in other parts of the world. Good morning or good day. Thank you so much for having me. I'm just uploading the talk just now. There we go. And for the purposes of the talk, I will switch on my video and then I will resume. So thank you so much for having me and inviting me. So today I will be talking about, kind of pandemic preparedness and response. And the talk will be based on an African perspective. As you would know that, COVID-19 has changed the way the world works and how the world functions. But it is important to know that pandemics are not a new thing. So there's nothing novel about pandemics. What is novel about the latest one was that it really affected the world equally and also affected us equally. However, you would have seen that the response to it was not even equal. We saw things like, vaccine apartheid coming in. We saw how some of the resources were kind of hogged by the global north and the global south not getting access. So this is also true at all times. And how we respond to pandemics literally is determined by what is literally happening within the continent that we sit in at the time. And if we are ready in a way to utilize certain technologies that are available to us. So today we will go through, what we mean when we say, a pandemic. So how we move from an outbreak to a pandemic. So through that source of concern and panic that we saw about the COVID-19 case. I will go through the history of pandemics from, the biblical times to what we have now. We will then zoom into the pandemics that Africa has faced. And we will then see the response of the world as to when those pandemics were happening within Africa. And then finally, we will talk about how, the current technological revolution assisted in the response of the COVID-19 pandemic. So this is what we will talk about, and also talk about technology adoption in the global south, particularly in Africa, sub-Saharan Africa. And what are the lessons learned and how we can, move forward from here. So, when COVID broke out with the first case in 2019 to what the world experienced in 2020, the first thing that came into everyone's mind was, what are we looking at, right? Are we looking at an outbreak? So is this something that is staying only in Wuhan in China and will only stay there and will not affect us? Are we looking at something that can spread, to multiple people across a kind of a larger, geographical area, but can still be contained? Are we doing something that will spread over continents and countries? And this is something that will then say this is a pandemic, right? Because at that point, when it spreads across countries and borders, then we know that it could not be contained in one area, and therefore we know that at a point where it happened, when the outbreak was seen, there was no vaccine or any treatment to contain it within an area. So this is what we call, a pandemic. And therefore, who declares a pandemic? So now we see, okay, this has kind of spread quicker than we anticipated and faster than we anticipated. But then who says we are in a pandemic, right? When South Africa experienced HIV at the way that it did in the 90s, would South Africa declare, say there's a pandemic, the world needs to stop and we need to panic and all hands on deck? Or, is there someone who comes as a regulatory body that comes and say, well, yes, this is what we experienced and what we're looking at as a pandemic, and we need all hands on deck in preventing and controlling the spread of this. And we need to strengthen our health systems, and we need to make sure that we have controlling mechanisms around, this disease or virus. Now, as we all know, the World Health Organization is basically responsible for declaring, an outbreak of a pandemic and also closing it off to say it's not a pandemic anymore, it's now under control. And one of the aims of the World Health Organization is to make sure that everyone gets the highest level of possible healthcare. So basically, one of the mandates is to promote equality and equity. And equity is quite important because we saw this during when the vaccine started rolling out in the world, that it wasn't very equitable amongst everyone, and some well-resourced countries started keeping the vaccines for themselves, and therefore kind of impeding on the promotion of equity and prevention and controlling the virus in itself. Now, when WHO decides to kind of declare what a pandemic is, one of the things that they look at basically is how do we coordinate international efforts to promote, health and prevent and control the disease, right? And we actually also respond to the emergency that happens. And doing all this, making sure that we focus on promoting the equity and strengthening the health systems. Now, this is what WHO does, and this is what is mandated to do. Now, guys, I still need you to kind of keep in mind the promoting equity. And again, also keep in mind how the pandemic is declared. And if you look at when we go through the history of the pandemics, always keep in mind, okay, when this happened, was this declared a pandemic? And was everything being done to ensure the international collaboration in preventing the spread of this pandemic when it was happening? So I need you to kind of, keep it in mind. And therefore, we'll also, by keeping that in mind, then it will also give you perspective of how, even though pandemics are defined to spread across countries and continents, but there seems to be a likelihood that it's literally a pandemic that all hands are on deck when it mostly affects the global north, right? And thus actually showing this divide amongst the global north and the global south. Now, one of the histories of the of pandemics, pandemics have had a very profound effect on our lives throughout history. They have shaped, economic, political, and social aspects of human civilization, right? And the effects actually have lasted for centuries. Now, certain things, we see them as just, under control, something like smallpox. But at some point, these eradicated and shaped humanity and populations, for centuries to come, right? In doing that, they also have challenged the ability of healthcare systems to respond to crisis. So they kind of have brought to forth, the inequality that exists in access to healthcare, the infrastructure that exists in healthcare, and if there is adequate primary even healthcare, to respond to disease control and public health education also. And until recently, we have viewed diseases from a medical and humanities perspective, right? Engineers have not been as involved as they were with COVID until recently. So disease have always been something, the medical guys do with the biologists sit down, epidemiologists sit down and deal with it. It's always been from biological, medical, humanities and social perspective. But we've never seen such interdisciplinary research and efforts coming together until the COVID-19 pandemic started. And we will also see what kind of counterparted all this interdisciplinary research and solutions coming in. So what actually allowed us to kind of do this interdisciplinary that we did with COVID-19 that we didn't do with other pandemics? Now, one of the, earliest recorded pandemics are the plague pandemics. Now, recorded would mean even, if you look at the Old Testament, so before Christ, there's a very recorded history of plagues in the religious scriptures. The Old Testament mentions the 10 plagues that strike the Egyptians before the Israelites are released by the ruler of Egypt, and these events, regardless of whether, they're factual or not, or you believe in it or not, they've deeply shaped human history and continue to be commemorated in religious practices throughout the world. Also, if you look at the Quran, you will see some, religious text on the history of plagues. And this is literally before Christ. And we also have some recorded history of plagues also, in the Bible, after Christ. Another one which is well known is the Justinian plague. And this is literally one of the earliest recorded plagues that struck Europe in the 14th century. And this was called by birds that was infested by fleas. And this literally plague is estimated to have killed around 25 million people And these are just rough estimates. And this plague also had kind of a very profound effect on European society, and causing economic upheaval and also social upheaval and religious and cultural changes. We see that around that time. Another one that that is also well researched and well known, and this is when people talk about the plague pandemics, this is what we call the Black Death plague. And this is another one of the pandemics that hit Europe in the 14th century, also caused by birds, so from animal to human transmission, and also has changed, the social being and socio-economic status at the time in the Europe, and shifted. Now, another one, we have your influenza pandemics. You have your smallpox pandemic. Smallpox is estimated to have killed around 300 million people at some point. It was basically eradicated around 1980 through basically global vaccination, right? You have the Spanish flu that is estimated to have also infected and killed a couple of million people, a lot, a huge number of that. But for those of us who, in any recent history, for those who are sitting here today, this evening or this morning, one that comes into mind would be the HIV/AIDS pandemic, which began in the early 80s and has since estimated to have infected around 77 million people worldwide, and also, resulted in half of that, in deaths. And it is quite prevalent in sub-Saharan Africa. Now, I would like for you to keep in mind, as you would know, that South Africa is also one of those countries that was literally, at some point, we had one of the largest numbers in the world of HIV infections. And this is one pandemic that, we felt the effect of it from the first reported cases in the 80s to where we are now. Then this is why for me today, we will be doing a comparison between how the HIV/AIDS pandemic was handled and how COVID-19 was handled, and what facilitated or what the driving forces behind the handling of these two pandemics. We also have the SARS pandemic, which was now caused by the novel coronavirus. It had around 8,000 cases, but it was quite, pandemic and endemic more than pandemic. We also had the Ebola, outbreak in Africa, since the 1970s, which the largest, the outbreak, which was large, happened in the mid-2000s, 2014, 2016. And what we have currently would be the COVID-19, with the first reported case, as you would know, guys, in 2019 to where we are right now. And this is, I'm assuming, one of the reasons that we're sitting here today, because we have learned so much from COVID-19 and how technology can be used in disease prevention and control, in diagnostic, going where humans can go in terms of screening and monitoring, delivering medicine and vaccines in places that would be unreachable otherwise without, AI tools. So this is quite important. Then we have, cholera. And cholera, you see it's endemic to Asia, around 1817. But when it comes on the 7th wave, then it becomes more of a pandemic, because then it moves to other regions, including Africa. Now, all these pandemics happen. So we've talked about, before Christ, after Christ, the 18th century, 14th century, the 80s, 50s, 60s, 70s, 80s, 90s, 2000s, and to where we are right now. So we need to put this into perspective when we talk about Africa and what was happening at every point in time in Africa around the time these pandemics were happening. Now, what was happening in Africa in the 80s, right? First reported case of HIV and AIDS. It's not in Africa, but it's reported nonetheless. Then what is happening in Africa is that, you know, a lot of countries are now, okay, let's start with the 50s. There's a desire around Africa for independence from their colonial powers. A lot of, you know, ground movement forces and liberation parties are gaining traction in order to liberate Africa from colonial power. Now, around the same time in the world, so in the global north, there is now the conceptualization of AI. So what is AI? What does AI look like? How do we measure AI? And this is where you look at, you know, Alan Turing coming with a hypothesis on the Turing test and how to test the Turing test. But at this time, as you can see, Africa is still under colonial powers, and the focus is on liberation. That is happening in the 50s. So nothing is happening in terms of AI and technological advances in Africa at that time. So you have the 60s, right? Countries are slowly gaining independence, you know, helping each other out with independence. Some are already getting independence. Some are now transitioning to get into independence. Again, the political landscape around that time in Africa is still very touch and go, right? National movements are still gaining momentum as people start to end colonization and self-determination. And the Cold War politics are now starting to infiltrate Africa. So while the war is happening in the global north, the effects are still being felt by Africa. Around the same time this is happening, advances in technology are happening, right? Now there's a new and emerging field within computer science that is focused on developing machines that are human-like, right? And exhibit human-like behavior and intelligence, right? So the birth of AI is happening in the 60s, you know, at the Dartmouth conference. Now we have our early AI programs that are focused, you know, on, you know, general problem solving, so solving mathematical and logical problems. We have NLP, natural language processing, coming up as a field where we're trying to teach computers to understand and generate human language. So this is an emerging field also. Machine learning is also coming, you know, then as an emerging field, which is now how do we teach these machines to learn and adapt from experience, right? And expert systems are also starting to be developed in the systems in the 60s, where we try to mimic decision-making abilities of humans into computers. So all this is happening in the 60s. Africa has still not joined the race, right? We are still not in the technological race because of the political climate at that time. Now the world is moving on without us. 70s, what is happening in the 70s? The overall political landscape is now marked by a lot of, you know, there's a new dawn. There's a lot of challenges and opportunities. Now we're seeing newly built independent nations that are wanting to enter the global world. We are now talking about regional integration, right? You know, the beginning of the African Union. And during that time, what is the world doing? We are still not in the race in terms of AI, right? For instance, NLP at that time requires you to know the rules of a language, because of a lot of the AI was rule-based at that time because there was no big data. But at that time, a lot of our indigenous languages are not documented. So we don't even understand how our languages work. We don't understand the structure for our languages. So we cannot even talk NLP because we don't understand the structure of the languages. So again, we are being left behind. Now, the world, we're seeing an emergence of distinct fields, right? Expert systems becomes a distinct field. Now we're talking about designing systems that can make decisions by themselves, right? And there we're talking about knowledge-based systems that could make decisions based on a set of rules. So we talk about rule-based systems. NLP is also seeing a rise, right? We're talking about your ELIZAs. Robotics is now coming up. This is the 70s. Again, political landscape does not allow us to enter the new race. The 70s are also marked where now, because of the world has entered this since the 50s, people are now starting to talk about the ethics of AI and the social limitations of AI. And people are now saying, okay, there are limits to what these computers can do. So we are not talking about them, we are not now talking about them performing and thinking and doing things like humans, but we now have to kind of realize that intelligence, you know, cannot fully be mimicked by a computer. So this is done in the 70s. Again, Africa is left behind, right? 80s, we see democratic transitions, we see, you know, conflicts happening around Africa. While there are some successes, you know, the development of the AU, there are still challenges, right? We still have economic challenges. We see a rising of debt amongst our countries, inflation, you know, some countries are going under sanctions like South Africa around that time. We see a lot of conflict and instability happening in South Africa. You know, countries like Sudan, Somalia, Liberia are actually experiencing conflict around that time. Even though we're talking about regional integration, there is still a lot that needs to, there are still a lot of hurdles, right? Because even though a lot of countries are now independent, the whole of Africa is not fully liberated at that time, right? The world at that time is now putting money into research and development of AI systems. Now, now we're talking about putting money and focusing on research and seeing the importance of AI, right? In the 80s. Again, Africa is slowly coming into play, right? And not that much, but it's slowly coming into play. We see certain research organizations coming up across Africa, but it is not enough, right, to now put ourselves on equal footing with the global north. Now, the 90s, right? Remember, the first case of HIV and AIDS is in the 80s. The 90s, what is happening in Africa, the landscape of Africa? We see a period of significant political change and transformation, right? We see democratic transitions. We still see certain conflicts and instability. You know, if you look at Central Africa, Rwanda in East Africa, Burundi, you know, we see a lot of displacements and other economic challenges by many African nations. But outside of everything that's happening, the instabilities, the wars, the new democracy, one thing is now starting to emerge in the 90s, right? There is now international engagement between Africa and the global north, right? Now we see a lot of high-profile visits by, you know, presidents of the global north, and therefore this is now changes the trajectory of where we are going as a continent. Now, what's happening in the country? Now, still Africa, politically, the climate is not for us to focus on technological revolutions and advancements as our global north colleagues are doing, right? But in the world, now significant strides are being made. The impact of AI becomes more prominent, right? People are now thinking of the risk and benefits of technology. Policymakers are now addressing issues of privacy, bias, accountability in AI systems. Now, all the strides are now happening around that time. Now, overall, the 90s, the world, in terms of the tech revolution at the time, we see that it's actually, this is the big decade for technology and artificial intelligence. Now, significant progress has been made in the development and application of AI technology. Now, in the 80s, more focus was on research and development. Now we're seeing the fruits of research and development in the 90s. And around that time now, HIV and AIDS is now starting to spread rapidly across Africa, right? This is mostly fueled by the socio-economic factors around that time and the lack of preventative measures and adequate healthcare system to kind of hamper the spread. So overall, in the 90s, HIV/AIDS becomes a major public health issue in Africa, particularly sub-Saharan Africa, right? Now, AI in Africa also now gets into play. what is happening, we now see institutes such as the Council of Scientific and Industrial Research in South Africa now starting to look into artificial intelligence, particularly, natural language processing, understanding, what we can do with natural language processing. As a country, we see developments coming in Dar es Salaam in Tanzania, also in NLP. A lot of the work in Africa in the 90s, you will see focuses on NLP. Tanzania is NLP, machine translation, speech recognition, language generation for Swahili. We see expert systems becoming used in some African countries in the 90s also, particularly healthcare. So expert systems, start taking, over in healthcare in some parts of Africa, such as Burkina Faso. We see South Africa and Zimbabwe starting to enter the teaching and learning of artificial intelligence. And the CSR in South Africa also now doing AI research. So there's movement. We are now starting to get into AI research and development, but we're not at applications yet. Now the world is now at applications, because the world, what we are doing in the 90s, the world did in the 70s and the 80s. Now, overall, in the 90s, Africa was kind of limited, and our contributions and efforts to develop technology on the continent was very, very limited compared to what other people were doing in the global north. In the 2000s, we still see HIV spreading across Africa, at alarming rates in the early 2000s. But in terms of AI, we are now starting to get into the race. So we are now seeing the fruits. We're looking at, mobile health technologies where we use mobile devices to collect and transmit health data. This is particularly done if you look in countries like Nigeria. South Africa has also started to look at how one can use apps to manage, to help patients manage the HIV medication. This is one of the first recorded interventions of AI, right, in response to pandemic, right? So mobile health is one of the interventions in assisting patients manage their HIV medication. This is around the early 2000s. Research and development is also now starting to take a very important role here. We see, East Africa now taking as a center stage, in terms of AI research related to pandemic response. We also see other tools being used to address pandemics, such as also not only HIV, but Ebola. We look at data analytics, where we start using AI to analyze data related to pandemics and disease transmissions, patient demographic, treatment outcomes. And this kind of helps, medical researchers understand the spread of disease better, and also put more effective measures of control of the disease. We also look at we see the rise of, or the emergence rather, of diagnostic tools for the treatment of pandemics. We see people starting to now design algorithms that can analyze resistance patterns and develop more personalized treatment plans. So we see in the 2000s the rise of computational biology as a field with specific context in Africa, right? Also, we see predictive analytics being used again, particularly in Ebola, to predict the spread of Ebola in West Africa, and also allow in guiding the allocation of resources to prevent, further spread. Now, what happens? As we are now advancing, we are now starting to see how AI can help, particularly with Ebola and HIV, and these are the biggest outbreaks that have been coming up in the continent. The first case happens now, 2019, the world as we know it, as that time we don't know. It's 2019, the first case is detected. 2020, the world as we know changes, right? But as opposed to other pandemics that have happened in the world, and particularly in Africa, is that we now have, the AI tools. We are now have joined the race in the revolution, in the technological revolution. And therefore, we can now start building our own technological tools to help with the, with the predictive analytics and measures, putting measures on controlling the spread. Also, we think, at that time, this is what we thought, right? In the world, AI, we have entered the fourth industrial revolution, right? Big data, we have large amounts of data that we can use to do a lot of data analytics. Africa is still lagging behind, but we are coming up with various technologies. All hands are not on deck as yet. However, we did see outside of when HIV came up, where Africa was still in a politically, in a political climate that was not conducive for us to enter the technological revolutions. When COVID-19 started, we had a political climate that allowed us to kind of, enter the technological revolution, and enter we did. We saw countries like South Africa using, apps for contact tracing. We saw countries like Rwanda using robotics for monitoring and screening. We saw countries also in East Africa using telemedicine. We saw a lot of researchers coming into using data analytics, predictive data analytics, sentiment analysis to predict the spread or the next outbreak within Africa, right? But as you could see, a lot of the times things that happen, Africa is always seen as, monolithic or as one. But as with all the revolutions that have happened in Africa, political or otherwise, technological revolutions have also happened in silos. So you will find that East Africa is much more mature in terms of where they are within the technological revolutions as compared to Central Africa. And you will see the reason this is that we cannot divorce the political climate or the political revolutions from the technological revolutions. So one cannot negate the other. We cannot do one without the other. Both environments need to be, to actually be conducive for the technological revolutions to actually reach a certain level of maturity where we can actually feel the positive effects of it. Having said this, right, all these things were happening, all the studies were happening, researchers across Africa and across the world were coming together to do research. Again, the global north was still ahead of us in terms of, how they used particularly predictive analytics in curbing the spread of the virus that we did. Nonetheless, but there are risks particularly that are still relevant to Africa that make Africans quite apprehensive in embracing artificial intelligence and the fourth industrial revolution in its entirety. And another thing is, there are concerns about the type of data that these models are been trained on. Now, for lack of a better word, we all know when we talk about this, machine modeling, is data in, data out. And what that means is rubbish data in, you get rubbish data out. Now, human biases cannot, we cannot forego the fact that human biases do impact the quality of data that are being used to train these machines. And if you don't have data that is representative of the diversity of Africa, like I said, Africa is not this monolithic continent that people would like to treat it as, right? This would also hamper, artificial intelligence. Another thing is transparency. Now, there is what we call, or we term the blackboard effect. We don't do enough education as to how these algorithms work, right? Now, with intelligence in machines, the workings of this algorithm sometimes also become a mystery to even their creators, right? Facilitated by the self-learning and unsupervised training and self-corrections. Now, people embrace predictability. Now, how do we make sure that we don't lose control of these machines, right? The more intelligent they become. it is not, it's not a secret that also Africa is built on a lot of unskilled labor. There is a problem, and this is a concern that, this risk has been highlighted by social scientists for a long time to say, how do we embrace artificial intelligence and the technologies that it comes with and the revolution that it brings without being fearful of losing our jobs, right? How do I tell, the guard who was standing at the door at the hospital with a thermometer checking the temperature that this robot is not going to take his job? The robot that will be doing the screening, right? How do I tell the truck driver who drives into rural, parts of South Africa or Africa to deliver medicine that we are going to send a drone to do that instead of him, so therefore he will lose his job? How do we say all this and expect people to embrace the technologies that are coming with this revolution? If we want to talk about, mobile health, for instance, which has been used in Nigeria and South Africa and Rwanda, how do we educate people to trust and adopt this applications? Now we saw this South Africa had a contact tracing application, and one expected that a lot of people would use this application, but people simply, the take up of adoption simply did not happen at the rate that it was expected, because people simply did not trust it and therefore did not adopt it, right? Technology literacy in developing countries is still a cause of concern, right? Another thing is, how do we make technology that is relevant and is used and is tailor-made for Africans? How do we make sure we are not just taking from the global north and plugging into the global south and hoping that people take up for it and it works? How do we tailor make it? And this basically goes back to us understanding what constitutes the global south, what is Africa, how does Africa look like, and understanding the landscape of Africa, and just not treating this continent as a dark continent and as B, a monolithic continent, where if you pass in one country, then you would assume that you pass in another country. This is quite important. Having said all that doom and gloom about the risk of AI, it is quite important to highlight a lot of opportunities. It's no secret that in Africa, we have, particularly sub-Saharan Africa, we have the digital divide. And one of the ways to bridge this digital divide is to use the technologies that come with and are powered by artificial intelligence, because machines can venture simply where humans cannot. Machines can go into, areas where we could not go because of, there's no transport infrastructure, or we just couldn't go. Things like birth registration, where, we know in a lot of our countries in the continent, we have a lot of unregistered birth, and if you don't have a registered birth, therefore you are a stateless person, and when you're a stateless person, you cannot access resources that would allow you to be a contributing member of society. But we can develop such tools for rural Africa, where we make use of existing indigenous tools and complement them with artificial intelligence and the technologies coming around it. Again, we are not replacing, we are complementing. Another thing is that these machines do process information quicker than us and faster than us, and therefore they allow us to make decisions quicker and have more efficient decisions, because we have a larger pool of data set. And this can also help, as it did when we saw with COVID-19, in pandemic prediction and preparedness, and also mapping up where the next outbreak will come up, and therefore allowing us to kind of plan the resource around prevention and control of disease spread. Now, that brings me to the end of our talk. Thank you so much, guys, for coming. And Dr. Blessing, over to you.
Okay, thank you very much for a well thoughtful presentation. And thank you, our viewers, for listening. And just a quick one. I really enjoy the fact that you took us the memory lane, the history lane of how Africa has evolved from, the political age to the theoretical age, now to the computational age, where we now think of using AI to solve our problems. And Africa, even when we can see that, somehow we are still a bit lagging behind from the perspective of the global stage, but Africa is also coming up with their own model. And it's quite interesting to, have a rejig of this kind of talk so that we can always understand where we're coming from, what we have done and where we are heading to, so that we should know that when we do locally relevant research, it is quite encouraged so that we can answer our African problem with the African result and African built technology, and not trying to use the global north technologies to force it on Africa. And as a matter of fact, a lot of people in the global north always think Africa is a country. Like if you go to America and ask people on the street, you find out that they think Africa is a country and not a continent. So it's interesting to have this kind of talk. At this point, it would be nice to, to have your questions in. It seems like everyone was on the same page with this talk today. We didn't have much questions, but if you have a question, you can also raise your hand to speak while I read the questions that we have received so far. Okay, so going by that, Roslyn Abba says, this is a nice presentation, well done. Okay, thank you very much, Roslyn. And this is to Professor Mpho. Yeah, Roslyn says that this is a nice presentation, and he says, well done. And Samuel Mbugwa also said, I love the history travel of AI and pandemics. That's interesting. And thanks to Professor Mpho for the, good talk, bringing us to the memory lane of where we are coming from. It's always good to understand who you are, where you're coming from, and to know the direction. I mean, who doesn't, if you don't know where you're coming from, you might not know where you're going. It's also interesting that we have this memory lane that is clearly, spelled out for us in terms of how we have come and the direction we are going, especially when it has to do with the health perspective of implementing AI in Africa. So Dennis Nkwete, sorry for not pronouncing your surname very well. Dennis says, not a question as such. Okay. It says not a question as such, but adding to the history, the point we made about lack of representation, lack of representative data, lack of reliable data is a huge problem for us. Oh yeah, I think it's a huge problem for us. I don't know if Professor Mpho has something to add to that. He's trying to, reiterate to or put more light to what you said about lack of reliable data. It's a huge problem, especially in the African perspective. I don't know if you have something to add to that.
I mean, it is a problem. Like I said, if you don't have representative data that is representative of the population that you are developing the technology for, therefore that technology is rather not useful for them, right? If we say we're developing a mobile health application that uses natural language processing, particularly, let's say, speech, right? Therefore, we're saying that we want to be able to reach the population that is not literate, and therefore they would use speech to communicate. And therefore, the data that we use for English, then we deploy this to Nigeria, and we say, okay, Nigeria is an English-speaking country mostly. Yes, it has indigenous languages, but it uses English. But in the data set, then we use American English to train our data set. when that technology is deployed to Nigeria, it cannot work because, Nigerian English is very different from American English. But if we run this risk all the time because our technologies are being developed by the global north without us. So no one is there in that room saying, but wait on, this is not how we speak, right? And you will find out that also, someone who is a first language Igbo speaker speaks a different English in terms of how they produce certain sounds, like someone who's a Yoruba speaker. And these are things that, that's why we need to develop our own technologies. We need to be there where our technologies are developed for us because we know ourselves more than anyone else.
Okay, thank you very much. Thank you very much. There's another question here. This question is coming from Lorraine Siyaman. Lorraine Siyaman says, how prepared are we in using these algorithms, especially for prediction, knowing that this is a knowledge-based field?
Basically, I think when you talk about predictive analytics, you need to say in which aspect would you want to apply predictive analytics, right? In certain cases, right, I would say use cases, there is enough data to do predictive analytics and use these algorithms and get accurate results. In certain cases, there is not. So if you were to, for instance, use sentiment analysis on one of the biggest social media platforms, or what is perceived to be the biggest social media platform by the world, and by the world I would say by the global north, and you want to do how people view vaccine acceptance in Africa, and you say I will use this biggest platform, and then after that I will find out how people feel about it, and then you will find that actually probably only 25 to 30% of Africa is actually represented in that platform, but it's been marketed as big because of the global north and its representation. So if you look at how many people from Africa are represented in that, and I'm not saying names because I'm not getting paid to advertise for anyone. Then if there's only 30% of Africans in there, whatever sentiment you're getting, can you really say it's representative, or is a representative view of vaccine acceptance in Africa? Is it a big enough pool to do that? And if also you look at the 30%, let's say it's 30% of people in Africa are in that platform, and then you see that if you look at Africa, we are a very young country, but only that, but we also have some huge inequality, and you see there's a certain class of Africans that are represented there. Would you still say the sentiment that's been, projected on that platform is still representative of how Africans feel about vaccine acceptance? Also, when I say Africans, again, this is not a monolithic continent, right? You need to say, developments in Rwanda, if you look at technology adoption and acceptance in Rwanda, it's very different than technology adoption and acceptance in Lesotho and Swaziland, right? So all this, we need to keep this in mind all the time when we talk about it in terms of predictive analytics. But like I say, certain, use cases, you can do predictive analytics and get good results. In some use cases not. This also, again, this is about data. If you have enough data to train your models, we might guess and go ahead. If you don't have enough data, then I would start with saying go get data.
Okay, thank you very much. I just want to ask these quick questions coming from Professor Jude Kong. He says there are two of them. He says, thank you for the excellent talk. Powerful, okay, excellent or powerful. What do you consider as main current challenges for use of AI for health in Africa? The current challenges of the use of AI in Africa, in health in Africa. Then another one is continentally, a lot has taken shape in recent times when it comes to data governance for the use of AI. Can you tell us what the African Union has done in this regard? I don't know if you have an idea what African Union has done in this regard of AI in the continent, and that of the current challenges in the field of AI, using AI in health in African context.
Yeah, so the problem with any of these technological tools that come up is that they tend to seek to replace the traditional way of life. Now, when you do that, you're already at the wrong footing. Then people don't already trust you. For instance, before we need to involve people that we are developing the technologies for from the beginning, right? We just don't develop and just deploy. And this is what happens all the time. People develop and then deploy, and then people don't accept it because we are developing things that no one asked for. And we are also trying it seems to them that we are replacing their way of life. And this is where people come in saying these technologies are taking our jobs. I don't trust this robot. I don't trust this and that. Now we need to find a way to complement the traditional way of life and how things are done with technology. Now, if we know in rural, in villages, around, the continent, that we have a chief midwife, right? For instance, birth registration, and this is where we say this is a large unregistered number of births happen in the villages. So people are being born and people are dying and we don't know about it in the villages because they're never registered into the formal structures because there are no offices there. So how do we do this? It doesn't help to just develop a mobile app and deploy it and hope someone in the village will download it and start writing on it, right? We need to understand that there's a midwife who literally knows every child who's been born there since the beginning of time, because of before that midwife, the midwives before is trained. So there's this indigenous knowledge system happening. Now, how do we develop a technology that this midwife will be comfortable in using, number one? Right. And the chief will also be comfortable in using, because this is our main point of contact. People trust the midwife to give birth to their kids and know when these kids are born and hold this, file in the head of this baby. So how do we develop a technology to facilitate birth registration for the midwife? And therefore that registration from that technology goes to the Department of Home Affairs or home registration. So therefore we're not replacing the current way of life, we're just complementing it. And therefore we are now sorting out the birth registration and we've solved the problem. So it is quite important. Now, how is AI progress in health relative to other fields and industries in Africa? Prof. Ali, you will find that any technological progress happens when there's money involved. So we look at, industries like mining. Mining has, advanced, greater than healthcare, because mining is more of a private entity and a multinational entity, right? Who owns the mines, of which when you talk about healthcare, this is more of a problem for the public and the government, because this is, a more general population problem than specific industries. And this is where you see the lagging behind in terms of AI progress in healthcare in relative to things like accounting, consulting, banking. There is significant advances in terms of applications being deployed in Africa there, because there's money being pumped into it. In healthcare, because of this is more government facing to the population, it is still quite slow, right? We see only in countries where the government initiates the solutions, like Rwanda and Kenya, this is where the uptake is a bit higher.
Okay.
So it depends on the funder, yeah.
Okay, thank you very much for your feedback. Another one is from Professor Ali Asgari. He says, great talk. A question, please. How is the AI progress in health relative to other fields and industry in Africa? So let me say that again. Oh, already answered. Okay. Okay, already answered. Thank you, Professor Ali. So I think I'll take two more questions, then we can end it from there. Okay, this is coming from Dennis Nkotein again. He said, Professor Mpho, please can you give a few examples of health-related projects you work on that involves natural language processing? Which natural language do your systems use? Thank you. So I think he wants to know the health-related solutions or something that you have done with your natural language processing and all that?
Okay, so one of the earliest projects would be for mobile health, and this was at the CSR at that time I was employed there, and we were using a USSD application and not, this mobile apps that we have, because we needed to understand one of the things that we had were mobile clinics being deployed to rural South Africa. So there's mobile clinics, the problem is people didn't know when they're coming or when they're not coming. Now, therefore, we developed a solution. At that time, it was isiZulu, Sesotho, and English, where people can inquire when the mobile clinic is coming so they can get their medication and so on and so forth. So that is, one of the solution. Now, I would like to say, Dennis, particularly in South Africa, we haven't seen outside of the COVID, even during the COVID-19, right? We don't see a lot of marriage between NLP and healthcare. And I will tell you this. So we are now doing a sentiment analysis project on COVID-19 response and so on and so forth. But then the language that has to be used is English, because there are no models, for sentiment analysis for the local languages in South Africa, like Sesotho and isiZulu. So then a separate project again by one of my colleagues, Mr. Roni, is about collecting data for our languages for the purposes of sentiment analysis. Again, we need to start from the ground root and get the data and then start developing the tools.
Okay. Thank you very much. Just another one here is from Lorraine Suyamana. I think this is not a question, is it? Is it one of our biggest challenges in using AI for the disease in using AI for the disease, and is that most AI is not trusted by the people themselves? I think this is not a question. This is like corroborating to what you're saying. It's not trusted because people in the rural villages are not part of the planning stage. Okay, great conversation. I have to leave now. This is from Leslie. Okay, Rosalind Abba also said AI is growing across other industries globally. Can you also choose major representatives in different countries across Africa, especially from major cities in Africa, and train them to raise young people at grassroots level to help build this education further across Africa? This is a question. Maybe you could just say something about this.
Does the person let me see the question?
Yeah, the question says that AI is growing across other industries globally.
Yeah.
And you also choose major representatives in different countries across Africa, especially from major cities in Africa, and train them to raise young people at grassroots level to help build this education further across Africa.
Yeah, I mean, we are seeing a rise in the establishment of national instituted national AI institutes. We see Rwanda, Kenya, South Africa just launched, I think last month. And the aim of this institute is, in response to how do we upskill, Africans, with skills that are necessary for them to enter this revolution and not be left behind. And we see this happening across countries. Like I say, it's literally a lot of it happens in silos in different countries, but we are seeing a rise in this. We are also seeing a rise in the culture of technological, startups, coming up with solutions that are tailor-made for Africa and particular regions across the continent. So we're seeing, more and more legislative support from governments across Africa. Even the AU itself has a white paper on AI, right? So we're seeing some progress in terms of legislative support, and this is what we need in order for us to get to the grassroots level.
Okay, thank you very much. I still have some few more questions here. I will take one from Liswa. Liswa says that it's talking about the issue of gender gaps in this technology. So she's saying that given the gender dynamics in the AI space, What are the gender dynamics that mediate the space, and how does this impact gender and access to healthcare in Africa? So, the issue of gender cannot be overemphasized, but I know you can say something about this and the gender gap in terms of AI and health.
I think access to healthcare, right? It cannot be overemphasized in terms of how women access healthcare, and particularly in Africa, and also African women across the diaspora. That is an issue for another day. And in terms of AI skills amongst women, I cannot speak for the continent, but we are seeing, particularly in South Africa, an increase in the number of female graduates, coming in, entering the workforce. But it is always important when we talk about AI, people think of developers, right, as a skill. But AI needs more than developers. It's now multidisciplinary. We need social scientists, right, to come up to remind us of the ethics of these computers that we want to be supercomputers. We need lawyers to bring legislative and make us understand the laws and govern the laws. We are seeing now where, the Silicon Valley guys are saying, let's pause a minute and come up with laws to govern ourselves. Therefore, in terms of AI, I would like for us to move away only from the coding skills, but to also kind of now start saying we need an interdisciplinary approach. And in that way, then we can talk about the gender gap. Now, if we want to talk about the gender bias, then that is a different story altogether.
Okay, thank you very much. Another one is from Maximin Descartes. Descartes is saying, first of all, says, thank you for the excellent presentation. And I said, what are the biggest challenges facing the adoption of AI by institutions and administrations in Africa? And what can AI solution creators do to facilitate adoption in the region?
We talk about the adoption of AI, and as if AI, certain technologies have been adopted widely, right, in certain industries. Now, I think what everyone here is talking about is AI for the public, for the common person. And therefore, and that is, has to be constituted legislatively. Now, if we talk about AI in mining, of course, the biggest mining companies are going to employ the technologies. If we're going to talk about AI in healthcare, if you look at countries like South Africa, where healthcare is privatized, of course, AI is going to take over, certain aspects of it. In the private healthcare. In the public healthcare, it's a different story. So all this needs to be put into perspective when you talk about AI in Africa. The political climate in Africa really, really drives how we approach these revolutions and how we enter the revolutions, right? And if you privatize something, of course, these multinationals have the money and are already competing on the global north. They will bring that technologies down to us to make their lives easier. But when you talk about how artificial intelligence works for the common man, for the public good, then we need to look towards our governments and ask them to first of all, they need to upskill, right? Bringing these technologies to Africa without us being able to use them, it makes no sense, right? You cannot give people mobile apps and assume they're going to be able to use them when you find that people don't even know how to use a smartphone. These are some of the things that are important. We cannot start at the top without fixing the bottom in Africa. What has the AU done? There is a white paper that I'm aware of, the last time I checked, late last year, on artificial intelligence, particularly the fourth industrial revolution, outlining the steps that different governments should take in approaching the fourth industrial revolution and in associated technologies. Certain countries, took heed of the call, like South Africa, and certain countries have not. Basically, yeah.
Okay, thank you very much. I'm going to take two last questions. I think Lauren Siamana says we are working on machine learning prediction of viral load failure among patients on ART in Zambia. I think this is not supposed to be a question. This is just telling us what she's doing in Zambia, or what they are doing in Zambia, as the case may be. So Victor Kibe says, thanks, Pros, for the presentation. how does AI in Africa, AI in health, thanks, Prof, for the presentation. How does AI in health setting address the issue of ethics and data protection? And I will take that question together with Professor Awedele's question. So he says, thank you for the wonderful presentation. My questions on the issue of AI adoption and cultural differences in Africa. Also, how to get I don't know, what is it, end data, or how to get data, Okay, so possibly AI adoption and cultural differences in Africa. Two questions here from Victor. Victor says, AI in health settings, how to address the, how does AI in health address issue of ethics and data protection in health, and also the issue of question of AI adoption and cultural differences in Africa. So these are two questions. Over to you, Prof.
Okay, I will start with the cultural differences and AI adoption. And like I said, it's important to understand the people that you're developing the technology for. And this is also understanding that culture, right? And once you understand people's culture, then you will understand whether they will accept the technology, and therefore if they accept it, then they will actually use it, and that goes to technology adoption. So all these three things need to be taken into consideration, and the best way to take this into consideration is to have a representative diverse team when developing these technologies. Let people tell you what they want. Do not make assumptions of what people want. That's basically how you work around this. And also, when you now deal with cultural differences in Africa, you will even learn that within the countries themselves, there are cultural differences, because within countries, Africa is built of nations inside of nations within these borders that we have. So it is quite important to understand that. Now, how does address issues of ethics and data protection? Again, this depends on who is developing a technology and what they want to do with data. The issue of ethics and data protection becomes a big issue because we see that data as money, right? Because data gives us insight. Insights allow us to make decisions. Marketing, advertising, product development all need this data to make insightful decisions for organization. And therefore, this is where it gets murky, when it comes to who owns the data and what they do with the data, right? And the issue of ethics. But ethics is bigger than just data in terms of how data is protected. And this is a huge issue in the global south, because if you give us technology from the global north, already the company holds the data. It belongs to them. If you sign up for the social media platforms, you click in, they already own your data. They can do whatever they want with it. They can track you wherever you want. And this is basically a problem. Now, how to get a clean data, it depends. For me, we are talking about data, and this is, I think, room full of researchers. How to get the clean data, it depends on what you're using this data for, right? You can get clean data on open source, or you have to start from scratch. In Africa, we find that we have to start from scratch. We have to start with collecting the data first, pre-processing it, finding insights as to how to best pre-process it and clean it, and so on and so forth.
All right. Thank you very much, Professor Mpho, for the responses and for the talk in general. And I want to use this opportunity to thank everyone for coming. I don't know if Professor Ali is on the line so that you do the closing. All right. So I have Professor Ali. Professor Ali is the director of CIFAL and our co-director in the AI for PEP network. I would hand over to him to say the closing remark.
Thank you very much, Blessing, and thank you very much, Professor Raborife. This was a very interesting talk, walking us through the historical background of AI applications in health in Africa. I'm sure everybody enjoyed that. On the interest of time, I'm going to summarize my concluding remark by this, but really appreciate your time, and considering that, the time difference, And all participants, thank you all for staying till this moment. Looking forward to see all of you in our next session, which will be in 2 weeks' time from now. And thank you again, Blessing, as well as Francesco for organizing this session on behalf of both partners here. And thank you, everyone. See you in the next session. Thanks. Have a great time.
Thank you.
Thank you. Bye, everyone.
Thank you, everyone.